Hey guys, so we wanted to address the idea of radiating chest pain with certain gym movements today. So we had somebody come in who was complaining of some upper trap tightness that kind of radiated into the chest with certain movements at the gym. And so a lot of times this person was going in and getting treatment just in the chest and the shoulder area, which would give them temporary relief but wouldn't last for very long. So I wanted to describe to you maybe what that could be caused from and how to address it differently for prolonged treatment and prolonged feeling better. And so if we zoom in here on this little nerve, I'm going to put it up to our skeleton so you guys can get an idea. Right here is a nerve that kind of comes out of the cervical spine or the neck, and it comes down, and this is the pec minor, and it attaches to the pec minor there. It's called the medial pectoral nerve. And so if we look at our skeleton here, we have nerves that come out of the neck, and as they supply the arm and the extremities in this direction, there's little ones that come off and supply the muscles of the chest here. And so if there's irritation to the neck here, to our little skeleton friend, either from specific movements in the gym, like maybe we're doing bicep curls, bent over rows, whatever it may be, and our neck is in certain positions that's driving irritation to those nerves, whether it be from a disc or bony changes of that sort, we need to address the neck first before we address anything else in this specific area. So if you were to come in to see us, we would definitely examine the neck. At home, what you can do is just maybe see if moving your head right and left or side to side, if you feel any tightness or a difference in range of motion with that at all. And if you do, what we want you to try out is what we would call just kind of a neck stretch. And so with a neck stretch here on the side of complaint, what this does, yes, we are stretching the muscles in this area, but we also are, if we look here, as we bend the opposite direction, we're opening up the holes of the neck here that allows for more room for those nerves to move. And so when we decrease irritation for longer periods of time to those nerves, you start to notice that any other areas, like the chest and the pec that we talked about, that are supplied by those nerves, start to feel a little bit better. And so maybe digging into those areas isn't the only treatment for you. We need to address the neck as well. So try this little opener, see if it works for you, and if it does, that's great, I'm glad, but we also need to make sure that we're rehabbing certain areas. Damn it, that's great, I'm glad. Okay. If that works for you, what am I saying here?
Maybe start with that little opener.
What?
Start with that little opener.
Okay.
If that works, good for you.
Okay. All right. So if you try this opener at home and it works for you, that's perfect. What we want to do then to make sure that you're staying out of pain for longer periods of time is a great rehab program for you. So if we're going to the gym and we're just fine-tuning certain movements so we're not driving irritation to the neck, that's what we need to look at if you were to come in and see us. So we're located in Huntington Beach. Give us a call. Let us know what's going on with you. Let us know if this worked for you so we know how to examine you and to move forward from there.